Now to war-torn Syria, a country that must be the one at least able to deal with the coronavirus. But a case was confirmed over the weekend, and Syrians are now bracing themselves for a lockdown. A full-blown outbreak would have severe consequences because a decade of civil war has devastated the country's healthcare system.
Syria. Some 400,000 people killed, millions displaced, entire neighbourhoods bombed to rubble. 9 years of civil war have left much of the country in ruins. And now there's a new enemy, the one that we're all fighting right now. These volunteers belong to the Syrian Civil Defence, better known as the White Helmets. In recent years, they've been providing emergency healthcare to war victims in Syria's opposition strongholds. These days, they're trying to save lives by sterilizing surfaces.
The coronavirus is spreading around the world and in Arab countries, and it's turning into a global epidemic that threatens human life. So we, the Syrian Civil Defense, in cooperation with the Department of Education in Afrin, are carrying out a preventative sterilization campaign.
Syria reported its first case of the novel coronavirus on Sunday, and the whole country is on high alert.
We are ready. The Health Ministry is ready. The Higher Education Ministry is ready. All medical and health sectors in the country are ready to be on one team, and we hope to overcome this thing.
But Syria's healthcare system is severely strained. According to the World Health Organization, less than 2/3 of the country's hospitals were functioning late last year, and 70% of health workers have fled the country. There's particular concern about the virus spreading in the northwestern Idlib province, where up to 1 million people live in overcrowded camps like this. It's the perfect breeding ground for the virus, and not the only one.
As WHO, we consider Syria as a very high-risk country, especially if we see that we do have vulnerable populations in camps, refugees, slum areas, at the outskirts of large urban centers. All these are actually high risk for coronavirus.
In Idlib province, checkpoints have been erected where the White Helmets are taking the temperatures of people who are traveling through. But if developments in other countries are anything to go by, it won't stop the coronavirus from spreading amongst Syria's most vulnerable.
Well, Ammar al-Selmoa is a White Helmets volunteer. He told DW that if the coronavirus does take hold in Syria, the results would be catastrophic.
You know, you see the lack of equipment, a global lack of equipment, for example, gloves, masks. There is a global lack of this, like a strong country with the strong, with a strong health system, actually are incapable to face this virus. What about Syria here? We are talking about a few hospitals. If we are at just 30 ventilators in all the northwest of Syria, we are, if this virus spread here, we will die like cattle. We will be devastating.
Syrian White Helmet volunteer Ammar al-Selmoa. Let's take a look at some more of the latest developments in the coronavirus pandemic. The number of confirmed cases around the world has now passed 400,000, doubling in less than a week. Italy's death toll has surged again. 743 deaths registered on Tuesday broke 2 successive days of declines. And Facebook has seen usage across its platforms a surge in countries with virus lockdowns. Italy has seen the biggest increase, with group video calls up by more than 1,000%.